Hello everyone, this is Shadi Reyes from CVI 2023 in Austin. I'm really privileged today to be with Dr. Devi Nair, who has been a pioneer into the left appendage closure, but she is an electrophysiologist by training.
Yeah, that's right.
Yeah, thanks for being in an interventional meeting, but electrophysiology by training. Thanks for being with us.
Thank you, Shadi. And it's such a privilege to be among our structural IC colleagues, and because it's a space where you need a lot of collaboration.
Absolutely.
Between EPs, structural interventional cardiologists, and structural imagers. Right. So this is where we built these collaborative platforms.
Absolutely. So I have been learning a lot from you, from conferences as well as from the social media platform about left atrial appendage, becoming an expert in that field. Yeah. But you introduced us just recently about a new technology for left atrial appendage closure. So I would like you to describe it for us, and where were we in terms of studying that device?
Thank you again for having me. So I'll be showing a case of a Laminar device. So it's one of the newer devices that's now being studied as part of the early feasibility study in the United States. The Laminar device is different than the current generation commercial devices that is out there, like the Watchman or the Amulet, because it's a rotational LA closure mechanism where there's a ball that goes into the appendage and rotates it shut. So you have a steerable 18-French sheath that exposes the ball in the left atrium. We take it into the left atrial appendage. We rotate the left atrial appendage. It's as simple as tying off a bread tie. Mm-hmm. So you rotate it and then you lock it. So the advantage is that you remove the LA volume completely, and also the exposed metal is the surface area of the exposed metal is very small compared to the current devices. So we could potentially eliminate things like peri-device leaks and maybe DRT.
Yeah, and also the need for antiplatelet therapy.
Yep, and that is being evaluated as well. Currently, we are in the EFS trial. We're doing DAPT for 45 days, mm-hmm. and we're seeing some phenomenal results. Too early to say, but still seeing some really good results. Hopefully, the goal would be to even maybe go to single antiplatelet at some point, maybe. Yeah.
So that device now at early feasibility?
It is an early feasibility study, which I think is phenomenal that we get to see early feasibility studies in the US now. So really thankful for that. But beyond that, I think hoping to go into pivotal clinical trials end of this year, maybe early next year.
Great. And in terms of indication, same as any other closure device?
Currently, yes. The advantage of this device is it's not really, it's almost anatomy agnostic, so it doesn't matter what anatomical shape you have, you're really just rotating the appendage shut, so that is going to be very innovative in my mind.
Yeah, so in terms of complication or anticipated complication, I know maybe you had none so far, but what the operator should be looking for? So
I think it's, you're talking about appendage, which is a very thin structure, and rotating it. So definitely that is where the trial comes into play. The early feasibility study is actually involving multiple operators, both EP and ICs, to see the variability in practice, and also to assess what are we looking at from complication rates. The concern obviously would be LA tear or effusion. We've, so far, fingers crossed, we'll see.
Yeah. And in terms of axis or sheath size, is the same size?
So it's an 18-French steerable sheath, mm-hmm. And it sits on a stabilizer. So the advantage of the stabilizer is that because you're rotating the appendage, you don't want to have to hold it, or so it has a stabilizer, so you can actually rotate it, take your hands off, assess it, and then go back to rotating it. So it's almost you get almost like the MitraClip. Exactly. The system actually almost looks like that. Yeah. And we're very much dependent on imaging. Obviously, the cases that I've done it with 3D and 4D TE, and also 4D ICE. And it's impressive to see how on 3D that ostium just closes up.
Yeah. You mentioned about assessing it when you are finishing with the closure. So what you look for, any leaks, is because you are closing it completely?
Yes, so we start off with making sure that when the ball is in the appendage, that we have engaged the appendage tissue, because as you rotate it, we want to make sure that we twist it and rotate it shut. And so as you're rotating, you're going to see on 3D that the appendage is completely getting occluded and excluded. And then once we rotate it, we'll get an angiogram like you routinely in, make sure there's no leak through, and then once it's in a good spot, we put the lock in, and release the device.
Yeah. All right. Well, thank you so much for enlightening us about Lariat, new device.
Laminar.
Laminar. I'm sorry. So what I'm going to do, I'm going to put a link in the description in the video, so at least to show the audience, because this is for me, it's the first time hearing about Laminar.
And I'll text you the link if that helps.
Thank you.
All right.
So thank you all for watching us. This is Dr. Reyes from CVI 2023. Dr. Devi, thank you so much for being with us.
Thank you, Shadi.
Thank you.
Thanks, Cecilia.
Yeah.